Hello, my name is Leah McLeod, and today I just wanted to present my personal interpretation of what the professional image of a nurse is. So, in my opinion, the nurse is many things. We are multifaceted and multi-talented, a jack of all trades, if you will. We are many professions rolled into one. So today I just wanted to speak on my own professional image of a nurse and explain how a nurse is more than just a nurse. We are educators, caregivers, healers, advocators, communicators, and ultimately heroes. So the nurse as an educator. Just identifies what it is the patient needs to know. What things have recently changed, any changes in condition or medication, any lifestyle changes that the patient may need to make, such as smoking cessation, diet and exercise. Does the patient have any misconceptions or specific concerns for the nurse to touch on? We also want to assess what the patient's style of learning is. So do they prefer something visual, such as a video, a presentation, a handout, picture, or diagram? Or are they hands-on? Do they learn best if they demonstrate a skill and then have them demonstrate the skill back? Or they could be an auditory learner. Do they like having one-on-one discussions or listening to podcasts? Videos will work well for auditory learners as well. And we are the first point of knowledge for the patient, and so we are ultimately responsible for making sure the patient is educated about their care. We are with the patient more than any member of the healthcare team, whether it be doctor, physical therapy, pharmacist, caseworker, etc. So we have to make sure the patient is able to understand what is going on. To do this, we do what's called a teach back, which helps understand where the patient is at with their learning and what they may need for reinforcement. And we're continuously educating the patient from start to finish, admission to discharge. Okay, the nurse as a caregiver. Often when patients are admitted to the hospital, they may not have anyone to turn to. There might not be any family or friends around. They may be extremely sick, low on funds, or homeless, even on their deathbeds. So needless to say, we treat patients at some of their lowest and most vulnerable points in life. We may be the only ones the patient has to count on, so it's important for us to be present for our patients and make sure that we're listening with intent and moving with purpose. Something as small as making sure the patient's basic needs are met, for instance, bathing them regularly, making sure their teeth are brushed, their gown is clean, their room is clean, they have time to walk around, and their pain is addressed. All of these things can really make a difference in their hospital stay and make them feel seen and cared about. It's also important that we treat the patient holistically. According to the Journal of Nursing Science, holistic approach takes into account the biological, social, and spiritual needs of the patient. So we need to make sure we are taking care of not only the body, but also the mind and spirit. Religious beliefs need to be respected and a chaplain provided if requested. If anything we do, we need to make sure our care is centered around our patient. While in the hospital, patients can feel as though they have lost control of their body, their care, or even their life. So it is important that we allow our patients to be involved and make decisions about what's going on. So the nurse as a healer. In nursing, our ultimate goal is to heal. We want to be able to take that patient from where they are and essentially heal them to their own personal level of optimal functioning so that they are able to return back to their communities and homes. The harsh reality is we're not going to be able to save every single patient. Our 60-year-old patient with COPD and a 35-year smoking is not going to be able to skydive or run a marathon, but we can educate them on smoking cessation and medication use, for managing their COPD, as well as treating whatever else they have going on. And for this patient, their optimal function may be, just getting a chance to return home with their grandkids or walking their dog at the park. So if we could do that for our patients, that would be great. Just set realistic goals that will get them to where they want to be and treat their symptoms, as well as provide them with lifestyle education. As we create these goals, we will also develop a care plan to follow that will help us reach them and outline the exact interventions to perform each shift until their goals are achieved. So, the nurse as an advocate. In the healthcare setting, it can sometimes be scary for a patient. They don't know always what's going on or what their next steps are. We want our patients to be at the center of their care, but sometimes they can be afraid to make their own decisions or go against what the doctor's recommendations are. So in these instances, it is our job to listen to the patient's concerns and be their voice. We need to stand up for our patients, especially in moments when they feel like they aren't being heard and the care is being done to them rather than for them. We need to hold others accountable for their actions and speak up. If there's a nurse on the unit that's been forgetting or neglecting to turn a patient who's on bed rest regularly, we need to speak up and remind the nurse the importance of frequent positioning and hold them accountable. Lastly, we want to be sure the patient has all of their resources available to them. So if they need help from any other members of the healthcare team, be it OT, PT, case manager, whatever, we need to make sure that we're advocating to get those team members on board. Okay, the nurse as the communicator. So one of the most important skills to have as a nurse is being able to communicate properly. So much can really be achieved when there's great communication between the patient, doctors, nurses, and other members of the healthcare team. So we must listen with intent, which means listening actively without distraction and listening with purpose. We need to think about the message our patient's trying to get across. We're able to build a better rapport with our patients this way, which allows for further trust and open communication. It's very important that our patients feel comfortable with telling us in full what's going on. It could even be a matter of life or death. So this is why it's good communication is so very important. The nurse also ensures that everyone is up to speed on our patient. We communicate with the doctor anytime there's a significant change to ensure the right intervention is performed. We also communicate with other nurses on the floor, especially during shift change and while doing bedside report. And last but never ever least, we communicate with our patients, keeping them up to date with changes in any therapies or medications and their progress in their journey to achieving better health. All in all, the nurse literally saves lives. We are ultimately the ones catching any critical changes in our patients and following whatever measures we can in order to get that patient stable. Nurses make a difference every single day. It is up to us to bring our patients back to their point of optimal functioning and help them to safely integrate back into their community. As the educator, we give that patient one-on-one piece of information that will always stick with them and prevent them from ending back up in the hospital. As a caregiver, we show our patients love and compassion and ensure their basic needs are met. As a healer, we treat their illnesses and nurse them back into health. As an advocator, we are their voice, ensuring their wishes are always carried out. As a communicator, we listen to their needs and truly hear them, thus building their trust. All of these combinations are what makes the hero a nurse. Thank you.